Plenty of commentators from both the left and the right have tried to use the pandemic as a new excuse to peddle their old pet causes. On the left, some have claimed that Britain fared badly during the pandemic because the British state had been hollowed out by austerity. On the right, some have claimed that Britain fared badly during the pandemic because the British economy is too globalized and too dependent on China. On both the left and the right, many have eulogized the NHS as the star performer of the pandemic. These three interpretations have one thing in common. They are all completely wrong. We only need to compare the countries that have done the best job in terms of coping with the pandemic, such as Taiwan, Hong Kong, Singapore, or South Korea, to the countries that have struggled most, such as Spain, Italy, Belgium, and yes, the UK. That is what I do in my new IEA report, Viral Myths: Why We Risk Learning the Wrong Lessons from the Pandemic. Do the best performers have higher levels of public spending? Definitely not. Quite the opposite. Do the best performers have less globalized, more self-sufficient economies? Again, definitely not. Quite the opposite. Have countries with state-run health services done better than countries that have different types of healthcare systems? Once again, clearly not. So what can we learn from the pandemic? The answer is precious little. A pandemic is an extreme situation. During a pandemic, the rules are different. A pandemic cannot tell us much about how we should run our economy in normal times.